Next, we'll look at the cross section of the ankle, and this image is useful to think about when learning the nerves for an ankle block. So I draw a circle, and then you've got to imagine that's like with a big toe and then the other toes. So they're the toes up here, and this is the cross section of the ankle. So the first thing I draw is the headphones, and this is just how I remember it. So here you'll have the medial malleolus and the lateral malleolus, and then between them you have the extensor retinaculum, and then in the middle you draw the talus, which is like a nose, and then a mouth, which is your calcaneal tendon. Next, we'll add in the nerves, arteries and veins. So we'll start by putting the great saphenous vein just anterior to the medial malleolus, and then we'll add in the saphenous nerve. And then following this, we'll add in the dorsalis pedis veins and the dorsalis pedis artery. And then we also have the deep fibular nerve here. So I used to remember it as DP because you've got dorsalis pedis and deep perineal nerve, but now we know it as the deep fibular nerve. However, you can still use DP to remember them. And then above the extensor retinaculum, you can have the superficial fibular nerves. And then laterally, we'll draw sural nerve, and this is near the small saphenous vein. And then on the medial side, we'll draw in the tibial nerve, not posterior tibial nerve, and we'll put in the posterior tibial artery and the posterior tibial vein. And there you have the ankle cross section with all 5 nerves.